Hi there, my name is Dr. Raj Chovatia. I'm a clinician scientist and dermatologist based out of Chicago, Illinois in the USA. The way we think about diversity in dermatology can be kind of confusing just because historically we've used so many different words to categorize people in different groups. So one of the historical terms that's just so synonymous with medicine is race, right? This idea that people somehow exist in these very finite categories based maybe something about where they live, what they look like, and this really has been ingrained in medicine for hundreds of years. But as we've learned, race is really just a socio-political category of identification more than a truly biologic one. But typically, when we're thinking about race, some of the common groups we divide people in based on their identification are things like white, black, Asian, and so forth. Ethnicity is another way that we group individuals, and this is typically shared language or customs, food, culture, things like that. So a very common distinction here is Hispanic ethnicity versus non-Hispanic ethnicity. Now, in dermatology, we've tried to sort of combine a lot of this into this idea of skin of color, really thinking about individuals that perhaps are not prototypically either light-toned skin or perhaps belong to a white racial group. The reason why this is kind of confusing is there's been so many operating definitions about what skin of color is. Are we referring to the actual pigmentation of skin, in which case we would be measuring pigment concentration, which we typically don't do? Is it based on a modified version of Fitzpatrick skin scoring, which is sort of this weird objective way of matching people to a very finite Pantone, which also doesn't really use the Fitzpatrick scale in the way it was intended? Are we simply grouping people based on race, looking for biologic differences, knowing that race itself isn't really a good proxy for that? All of the above is kind of the answer, but this is the reason why our terminology behind sort of what skin of color is a little messy and probably needs a little bit of redefining as we consider diversity when it comes to thinking about our patients in dermatology.